What I'm about to tell you could change the way you think about the blood pressure pill sitting on your nightstand right now. Every single day, people wake up, pour a glass of water, and take amlodipine without a second thought. They trust the prescription. They trust the label. They trust that if their doctor gave it to them, everything must be fine. But here's the problem. Most people taking amlodipine do not fully understand what this medication is actually doing inside their body. They don't understand why their ankles started swelling. They don't understand why they suddenly feel tired, heavy, or lightheaded. They don't understand why one person can take it for years with no issues, while another starts feeling worse within weeks. And they definitely don't understand what signs should never be ignored. I'm Dr. Clara Hoffman, and in this video, I want to walk you through the truth about amlodipine in plain, simple language, not to scare you, not to make you throw your medication away, but to help you understand what your doctor may not have had time to explain. Because when it comes to blood pressure medication, what you don't know can hurt you. By the end of this video, you're going to understand what amlodipine really does, why it helps some people and causes problems for others, which side effects matter more than most people realize, and what questions you need to ask if you're taking it right now. And before we begin, if you care about protecting your heart, your brain, your kidneys, and your future, subscribe to my channel. I'm Dr. Clara Hoffman, and this is exactly why I make these videos. So let's start with the most important question. What exactly is amlodipine doing inside your body? Amlodipine is a medication from a group called calcium channel blockers. Now, I know that sounds technical, but the idea is actually simple. Your blood vessels are not just passive tubes. They have muscles in their walls. And that muscle helps control how tight or how relaxed those vessels are. When those muscles tighten, the vessels become narrower. And when blood vessels become narrower, pressure rises. Amlodipine works by blocking calcium from helping those muscles contract as strongly as they normally would. So what happens? The blood vessels relax, they widen, resistance drops, and blood pressure comes down. That is why the medication works. And on paper, it looks brilliant. Relax the blood vessels, lower the pressure, reduce strain on the heart. Simple. But here is what many people are never clearly told. That relaxing effect does not happen in just one perfect controlled place. It happens throughout the body. And once you understand that, a lot of the so-called mystery symptoms suddenly start making sense. Let me tell you about a patient story that reflects what I see all the time. A woman in her 70s starts amlodipine. Her blood pressure improves. Her doctor is pleased. Everything looks better on the chart. But a few weeks later, she starts noticing something strange. By late afternoon, her shoes feel tighter. Her socks leave deep marks around her ankles. Her feet feel heavy. And she starts wondering if this is just part of aging. It isn't. This is one of the most common issues people run into with amlodipine, swelling, especially around the ankles and feet. And here's why it happens. Amlodipine can relax the smaller arteries very effectively. Blood flows into the lower legs more easily. But the drainage back through the veins does not always match that change perfectly. So fluid starts to collect. That is why some people notice ankle swelling, foot swelling, or that heavy, tight sensation by the end of the day. And this is where so many people get dismissed. They're told it's nothing. They're told that happens sometimes. They're told just keep an eye on it. But if that swelling is affecting your walking, your comfort, your shoes, your skin, or your quality of life, it matters. It may not always be dangerous, but it is not meaningless. And sometimes it is the body telling you this medication may need to be adjusted. Now let's talk about another symptom. People often don't connect to amlodipine. Dizziness, especially when standing up, especially in the morning, especially when getting out of bed too fast, or standing after sitting for a while. Why does that happen? Because if your blood vessels are more relaxed, your body may have a harder time keeping blood pressure stable in that exact moment when you change position. For some people, that means a brief wave of lightheadedness. For others, it can mean weakness, fogginess, feeling off balance, or even feeling like they might faint. And this is where people get into trouble because they don't blame the medication, they blame themselves. They think they're tired. They think they're dehydrated. They think they're just getting older. No. Sometimes your body is telling you that the blood pressure is being lowered in a way that does not feel good for you in real life, even if the numbers look perfect in the clinic. And that is one of the biggest problems with how these medications are sometimes managed. A person can look controlled on paper and still feel terrible in their actual day-to-day life. That matters. Your life is not a spreadsheet. Your body is not just a number on a monitor. And if the treatment is making you miserable, that should never be brushed aside. Now, before I go any further, I want to be absolutely fair. Amlodipine is not a bad medication. For many people, it works well. It lowers blood pressure effectively. It can be a very useful part of treatment. Some people take it and do just fine. So this is not a panic video. This is an understand what you're taking video, because the danger is not just the pill itself. The danger is taking a medication for years without understanding the trade-offs, the warning signs, or the questions you should be asking. Now let's go deeper, because swelling and dizziness are only part of the story. Some people on amlodipine also notice flushing, a warm face, headaches, a pounding sensation, fatigue, a feeling of heaviness in the legs, sometimes even palpitations. And the reason this can be so confusing is that none of these symptoms scream one obvious answer. They're subtle, they're easy to dismiss, they creep up slowly. That is exactly why people stay on a medication for months, sometimes years, without realizing the drug may be playing a role in how they feel. And there's something else most people are never clearly warned about: drug interactions. When doctors prescribe amlodipine, many patients get very basic advice: take it daily, be consistent, watch your pressure. But what they often do not explain in detail is that other substances can change how this medication affects you. One of the most famous examples is grapefruit. Most people hear that warning and think it's random. It isn't random. Certain substances in grapefruit can interfere with how the body handles some medications, including amlodipine, and that can lead to stronger effects than intended. In plain English, the dose in your body may not behave the way your doctor expected. That can mean more dizziness, more blood pressure lowering, more side effects, and grapefruit is not the only issue. The real problem starts when multiple medications begin overlapping, because many people taking amlodipine are not taking just one pill. They may also be taking cholesterol medication, something for heart rhythm, something for diabetes, something for pain, something for sleep. This is how problems hide. Not in one's prescription, in the combination. That's why one of the smartest things you can do is ask your doctor or pharmacist to review your entire medication list together, not one bottle at a time. Now, I want to talk about something that frustrates me deeply: the way some patients are left in a half-treated state. Here's what I mean. A person starts amlodipine, their blood pressure improves, but they get side effects, so the dose gets lowered. Now they feel a little better, but their blood pressure is not truly where it should be. And then what happens? Nothing. They just stay there, not feeling great, not fully controlled, not fully reevaluated, just stuck in the middle. And this happens far more often than it should. Please hear me clearly. You do not have to choose between uncontrolled blood pressure and feeling awful. There are other options, other medication combinations, other strategies, other classes of treatment. If amlodipine helps but causes problems, that does not automatically mean you have to suffer in silence. It may mean the dose needs to change. It may mean another medication needs to be added or substituted. It may mean your doctor needs to look at the bigger picture. That is the conversation too many people never have. Now let's address another important question. Why does amlodipine work beautifully for some people and feel like a disaster for others? Because medicine is never as one-size-fits-all as people want it to be. Different people process medication differently. Different people have different body chemistry. Different people have different patterns of blood pressure. Different people tolerate vessel relaxation differently. Different people have different sensitivities to side effects. That means the exact same dose can feel smooth and easy for one person and miserable for another. And this is why comparing yourself to someone else can be so misleading. Your neighbor may love it. Your brother may have zero issues. Your friend may say it changed their life. That does not mean your experience will be the same. Your body gets the final vote. Now let's talk about something extremely important: stopping amlodipine suddenly. This is a mistake some people make when they get scared or frustrated. They read something online, they feel swollen, they feel dizzy, they get annoyed, and they decide, I'm done. That is not a safe way to handle a blood pressure medication. If you want to stop, lower, change amlodipine, that conversation should happen with your prescribing doctor. Why? Because uncontrolled blood pressure is not harmless. A lot of people are more afraid of the medication than they are of the thing the medication is treating. And that is backwards. High blood pressure can quietly damage the heart, brain, kidneys, blood vessels, and eyes over time. So if you stop treatment without a plan, you may be walking away from side effects and straight into a more dangerous problem. That's why the goal is not emotional decision-making. The goal is smart decision-making. Now let me bring up something that almost nobody talks about enough: monitoring. People treat blood pressure medicine like a set-it-and-forget-it arrangement. They get the prescription, they refill it, they swallow the pill, and they assume that as long as nobody calls them, everything must be fine. That is a mistake. If you are taking amlodipine, you should know your numbers, not guess. No. You should be checking your blood pressure at home properly and regularly. You should know whether your readings are stable. You should notice whether they are higher in the morning, lower at night, or all over the place. And you should also be paying attention to your body. Are your ankles swelling? Are you feeling more tired? Are you getting dizzy when you stand? Are you having headaches? Are you noticing palpitations? Are you feeling weak? Are you just not feeling like yourself? These things matter. Because sometimes the first sign that a medication needs review is not a dramatic emergency. Sometimes it is a pattern, a slow pattern, a subtle pattern, a pattern you only catch if you are paying attention. Now, I want to speak directly to the person who has been taking amlodipine for a long time and thinks, if something were wrong, surely someone would have told me. Not necessarily. Doctors are busy, appointments are short. Symptoms get mentioned late, details get missed, patients forget to report things, medication lists get long, and over time, people normalize problems they should have brought up months ago. That is exactly why being passive with your health is so risky. If your legs are swelling, say it. If you feel off balance, say it. If you are exhausted in a way that feels new, say it. If you feel your treatment is not working, say it. Do not wait to be rescued by a system that may only see you for a few minutes at a time. Advocate for yourself. Now let me give you the practical checklist I wish more people knew from day one. If you are taking amlodipine, here is what you should be doing. Take it consistently at the same time each day. Do not skip doses casually. Do not double up randomly. Do not take it one day and forget it the next. Monitor your blood pressure at home with a reliable machine. Write the readings down. Patterns matter more than memory. Watch for swelling in your ankles, feet, or lower legs. Pay attention to dizziness, especially when standing. Be careful with anything new added to your medication routine, including over-the-counter products and supplements. Ask about interactions. Do not assume natural means safe. Avoid making medication changes on your own. If you think the medication is causing problems, contact your doctor and discuss a plan. And most importantly, understand your goal. Why are you taking this medication? What blood pressure range are you aiming for? How will you know if it is working well for you? Not just on paper, but in real life. Those are not small questions. Those are essential questions. Now, I want to end with something I think people desperately need to hear. Amlodipine can help you, but help is not the same thing as perfection. A medication can be useful and still have side effects. A medication can lower your blood pressure and still not be the best long-term fit for your body. A prescription can be common and still deserve serious respect. That is the part too many people miss. Common does not mean casual. Just because a medication is prescribed every day does not mean you should take it blindly. Know what it does. Know what to watch for. Know how it feels in your body. Know when to speak up. I'm Dr. Clara Hoffman, and if there is one thing I want you to remember from this video, it's this. Do not be passive with blood pressure medication. Be informed, be observant, be honest about what you're feeling. And never assume that good enough is the same as truly well managed. If this video helped you understand amlodipine in a way no one has explained before, subscribe to the channel right now. I'm Dr. Clara Hoffman, and I make these videos so you can ask better questions, spot problems earlier, and protect your health with open eyes. And if you know someone taking amlodipine for blood pressure, send this video to them. Because the more people understand what they're putting into their bodies, the safer they become. Take care of yourself. Pay attention to the signals your body is giving you. And I'll see you in the next video.